Please welcome Claudia Peitzsch, National Center for Tumor Diseases, Dresden. Role of cancer stem cells in radio-oncology.
Good evening, everybody, and thank you very much for the kind introduction. Today's cancer care is a multimodal concept combining surgery, radiotherapy, and cytotoxic chemotherapy. And I just want to stress out that approximately 50% of all cancer patients receiving radiotherapy today. The field of radio-oncology improved tremendously during the last decade. Precision, I just want to mention modern particle therapy such as proton therapy here. But nevertheless, local control rates are low in certain types of cancers. Molecular mechanisms influencing radiotherapy failure are, for example, a high degree of intratumoral heterogeneity and cellular plasticity. And we are hypothesizing, and everybody knows that tumors consist of several clones which are changing over time, influenced by cell intrinsic features and external stimuli such as lack of nutrients or therapeutical pressure. We are hypothesizing that both resistant characteristics of tumors are driven by the so-called cancer stem cell population, a small population within the tumor with high self-renewal potential and long-term tumor propagating potential. We observed the phenomenon of irradiation-induced cellular plasticity some years ago in the lab when we treated a prostate cancer cell line with a single dose of 4-Gray and measured stem-like characteristics. And what we have seen is that it's increasing over time stem-like properties and function. We identified as underlying mechanism epigenetic and metabolic mechanisms, and when we epigenetically and metabolic target these cells, we were able to turning the resistant cells into a more sensitive state. How to translate this into clinical application? What we have done is we analyzed circulating tumor cells in the bloodstream of prostate cancer patients during the course of radiotherapy. And what we have seen is that in patients with high tumor burden, we see more circulating tumor cells compared to the low tumor burden patients. But when we analyzed also the phenotype of these circulating tumor cells, we saw a different population with stem-like properties, and this heterogeneity was changing in time. How this predicts radiotherapy response is still under investigation. Thank you very much for your attention.